Hi, this is Mark Grossarth from Heritage Family Credit Union. Heritage Family Credit Union is a proud sponsor of the 2020 Bennington Chamber of Commerce Lunch and Learn series. I hope you find these seminars insightful and educational.
Good afternoon. My name is Matt Harrington. I'm the Executive Director of the Southwestern Vermont Chamber of Commerce. We're broadcasting live today, Tuesday, March 24th, from CAT TV studios in downtown Bennington. As we promised in our last broadcast, we'd be updating both the citizens of Bennington and the greater citizens of the region. And if you're tuning in from another place in the nation or just even in Vermont, we welcome you as well. As promised at the last telecast, we'd be updating with our friends over at the Southwestern Vermont Medical Center, and in particular CEO Tom D. and Chief Medical Officer Dr. Trey Dobson. So today they're joining me again in CAT TV studios. Welcome, gentlemen. Thank you for joining us. A lot has changed in 1 week, and we are so appreciative of the last telecast that we did, that I think was more of an overview of the COVID-19 crisis, how specifically the hospital was handling it, and some recommendations. Today we hope it's not as long. We hope to do a couple of these throughout the coming months and weeks as necessary. So we plan to keep it short if shortness and brevity is available. So with that, maybe give us a little update from last Tuesday to this Tuesday. What are we looking at in terms of the hospital, in terms of the virus, and even from a state and regional level? What are we looking at?
Well, maybe Matt, I can kick it off, and Trey can follow up. Just since last week, I want to have your listeners know that our board of trustees met virtual meeting. Now we now do that, no face-to-face meetings, but they met on Friday, and you just should be aware, the community should be aware that they have reaffirmed their full support in the resources of our health system to combat this pandemic, and that's critical. This is a challenging time for all of us, and one of the things that we're doing, I'm spending a lot of time on right now, and Dr. Dobson will talk more about it, is doing a surge plan. We're expecting to increase our volume at the hospital, and we're licensed for 100 beds. We're fully activating all 100 beds. They will be available with staff members, and along with that, we're expanding our emergency room capabilities, and these are major initiatives. And also looking to create other potential alternative sites for surge in case that we need it, to be prepared for all events of any type of increase in volume that we can't handle on our existing campus. The board is reaffirming, and Dr. Dobson is really leading this planning efforts, especially with his background in emergency medicine. He's well suited to handle this type of initiative. But we're also working very closely with the State Department of Health, a major ally here. We're working with the Department of Emergency Preparedness in the state of Vermont, as well as working with many local healthcare and non-healthcare organizations in terms of our initiatives. We are taking steps to change our operations on a daily basis, and as of today, I want you to be aware. And these are difficult decisions, because this is not the type of health system that we want to promote. But we are limiting our visitor policy as of today, and we have to reduce. Basically, we're limiting visitors coming into our hospital, with the exception of maternity patients and pediatric patients, which will have their moms or significant others be available to come, moms and partners. So these are steps we're taking short term, but we're trying to protect our patients, our staff, and other visitors as other people come into our health system. So these are, again, challenging times, and maybe I can ask Trey to talk about what we're doing in terms of our surge planning.
Well, Matt, there's definitely humility in admitting there's much we don't know about this situation. But from a healthcare perspective, we anticipate, as Tom said, a significant volume increase. That's what other organizations throughout the world have seen. We don't know exactly how it'll affect Bennington, Vermont, as opposed to a much more urban area like New York City, and the news coming out of there today with their significant volume increases. But we anticipate probably a 300% capacity in the hospital, and that's what we are aiming for, to be geared up for. It's about all we can fit into the facility. As Tom said, 100 beds. On a typical day we have about 35 patients in the hospital, 40 patients. This would be about 100 patients in the hospital, most all of whom are there because of the COVID infection. As opposed to post-operative healing, we've stopped all of those types of procedures in preparation. We see two areas where the volume would significantly increase, and they are pretty straightforward. That is presentations to our emergency department with patients that are sick and may or may not be in need of hospitalization. You've seen that we've asked, and you've seen it from other organizations, that patients come to the emergency department if they need to be seen, but if they do not, if they can stay at home, that's what we need to have happen so we can focus on those patients, particularly the vulnerable patients that can't deal with the cough and fever and shortness of breath like maybe someone else could. So we are taking an area outside of the emergency department. We've got a couple of different areas that we're making into a respiratory evaluation center. And that way, when someone comes to the front door and if they have a broken leg, they'll come to the emergency department. If they're having a heart attack, they'll come to the emergency department. If they're having respiratory symptoms, they'll go to this separate area. Staff are dedicated there to only respiratory illness. They have the right equipment on, the means and the processes to treat people efficiently. And we anticipate most of those patients will actually go home. If they need to be admitted, then they'll come right through our system. They'll bypass the emergency department through a much more efficient means, go upstairs, and like I said, we're looking at about 100 patients in the hospital. And we believe that will happen. We talked about this a little last time. The question is, how fast does it happen? If it does it over time slowly, we, like other hospital systems, will be able to absorb it. And if it comes all at once, then we'll be in some trouble. That's how the world is seeing it. That's what the news coming out of New York is. So we're trying to be ready and prepared, but I don't want to give a message that says everything's under control, because it's clearly not. We're doing the best we can, and we feel like we have a great staff, we have good facilities, and we anticipate this volume surge over the next probably 4 weeks.
Okay.
What's been amazing, Matt, is that the response from our employees. We mentioned last week that we're going through and we're redeploying staff, we're retraining nurses maybe who've been not at the bedside for a number of years. Now are coming in, they're going through training sessions with us. Dr. Dobson's getting calls almost every day from physicians wanting to help out.
Absolutely. Yeah.
And it's been a remarkable response. And our non-clinical staff, everyone wants to help. So we're doing a major redeployment plan, and we're getting lots of calls from the community just asking, how can we help? And we appreciate that. And again, we get through this by working together. And I think this is a great example of everyone in the health system pulling together with the support of the community.
Sure. I want to remind our viewers that if you do have questions for Dr. Dobson or Tom D with SVMC, to make a comment in the Facebook Live or shoot us an email or check out the website. But really, we're fielding some comments through Facebook Live right now, and so I want to ask a couple that we're getting. I also want to remind people, if you go to swvtchamber.com, there is a business resource page. We update it at least every 24 hours based on information we're getting from the tax department, the Agency of Commerce and Community Development. Up there is also the hospital's toll-free number to call about things like this. So I think from a business perspective, Tom, you mentioned the outpouring of support and effort from a medical perspective. We equally at the Chamber, and I know the downtown business organization, as well as up in the North Shire, have seen an overwhelming outpouring of support for a lot of the small businesses that have had to either shut down or kind of refigure out how they're doing business. And so we're getting reports daily on that. But all that to say, make sure you go to swvtchamber.com if you want to be updated on business updates and business, in terms of taxation and unemployment and things like that. We want to make sure you look at that. I do have a couple questions I want to feed over to Dr. Dobson and Tom as well. I think let's start simply. This was right before we went live. Dr. Dobson, what can we do? A lot of us are homebound now. What can we do to remain healthy, I think, from a mental perspective, but also from physical? How do we keep up our immune system in the Vermont Marches and Aprils that we're so accustomed to?
Sure. Well, first off, let me just acknowledge it's very tough. It's tough to get outside and exercise. But I do want to say some people have received a mixed message. They think that being homebound means being inside the home, and that is not the case. It's being not in public areas, but going on a run and staying away from people. You're not going to catch COVID, nor are you going to spread it through exercise outdoors. So that's very important. That's not only important physically, I think most people are realizing it's important mentally as well. And then anything that you were doing for exercise outside the home, as Matt and I were talking about earlier with our gym being closed, you try to find comfort in doing it inside your home. And I'm running into the same problems. It's hard for me to change my mindset in that way. But once you do, it becomes a pattern, and that's what we're going to be dealing with for the next several weeks to several months.
Great. And for other people, if that was a kind of an interesting question and topic for you, we will be airing live with United Counseling Services on Thursday to talk about practicing some mindfulness, some resiliency, and obviously mental health as well. So we'll be working with our friends over at United Counseling on Thursday. So tune back into Cat TV Facebook page and on their channels at 1 o'clock on Thursday. One question coming up here, are there test kits at SVMC, and what is the situation? How do I get one? How do I get tested? But really, are there testing kits as well?
Sure. Well, so let me just say continues to be a limited supply of testing kits throughout the nation, despite what you may see on the media where a new manufacturer is promising to create, hundreds or millions. Those will come, but right now that is not the case, and it is regional as well. There's regional deficits, and in Vermont we're no exception. And as I think people may be aware, we've tried to push this out, but SVMC nor really any organization around are doing testing for outpatients. We are reserving those tests for patients that are very sick and need to be hospitalized, and for healthcare workers who become sick, because we need to test them to get them back into the workplace when appropriate. And the governor and the head of the medical system there, Dr. Levine, Commissioner of Health, has made that pretty clear. That will change when more testing kits become available.
Okay. A question coming up about masks, and I think we can kind of talk about a bunch of the things that are out there now. Where and when should I wear a mask? Should I wear a mask if I have no symptoms? And let's also talk a little bit about glasses that people are wearing, or even hand sanitizer.
Mm-hmm.
When is that all appropriate? Should we be doing it, and where and when?
So what is known is that someone who has COVID or other respiratory illness spreads that through droplets, or by touching their mouth and then touching a table and someone picking that up. And masks help prevent that spread. It's not felt that wearing masks in the public for asymptomatic actually helps prevent you from getting that disease. That being said, people want to do it, and that's okay. It's not hurting anything. It's just not likely preventing them from getting the organism. Hand sanitizer definitely does. When you use hand sanitizer with an illness like COVID or influenza, we know that it kills that virus. In other words, the virus is rendered non-infectious at that point. And that's not the case with all illnesses, but it definitely is the case with COVID. So using hand sanitizer using hand sanitizer as much as possible every time you certainly come in contact with another human being is important.
Yeah, we were talking with one merchant that, and let me know, doctor, if this makes sense, that I think a lot of people are now experiencing the drying out because of the alcohol and stuff like that. Really working fingertips more so than maybe the whole hand, or should we just be safe and be doing the whole hand, the whole gamut?
I haven't heard that doing just the fingertips. It may make a little sense, but I would need to see some data behind it that shows that makes a change.
Gloves, obviously, that's another big thing as well. What's the situation with gloves? We were talking with the studio here before that, it doesn't help if you walk into a grocery store with gloves and don't wash down the handlebar to the cart that you're using, and then putting those gloves elsewhere. So talk to us a little bit about the glove protection as well.
Yeah, so really gloves are not helping you. When you put a glove on, you're still doing the same thing. You're touching your face, you're touching an object, and then touching your mouth, and it doesn't matter if you have gloves on or not. That's how you're going to spread the illness, and that's how you're going to take it. Healthcare workers wear gloves because they put the glove on, to touch the patient, to help the patient, to heal the patient, and they take the glove off right away. When I see the folks wearing the gloves in the grocery store, they're not doing that. I suppose if you put the glove on, went and touched an object and took the glove off, then you would have less chance, but that's not what people are doing. What you need to do is carry the hand sanitizer around and use it whenever you have that opportunity.
Okay.
And Matt, we're trying to keep the supplies of gloves, masks, goggles, as much as possible for the healthcare workers who are really caring for the patients every day. So that the more that people go out acquiring these, it does deplete the general supply.
Yep.
And we're working very hard with many sources to try to increase our supply.
I was going to say, I saw something recently about Dartmouth Hitchcock working on that. Can you elaborate a little bit? Both, I think there are some manufacturing companies locally that are working on some version of some of the supplies running out, but also the partnership with locals. I know a lot of people that are trying to sew masks as fast as possible.
You know who's really stepped up and working with us is Mac Molding. Mac is you all know, it's a great company, and Jeff Sumpel, their president, has been in contact with us, and they're trying to work on fabricating some of these masks that we can use in the hospital. So we're appreciative, and I know other health systems have been reaching out to them also.
Can you give a basic report out of how many cases locally we currently have, and how are those folks doing?
Yeah, we've roughly had 10 cases test positive here, about half of which were hospitalized. I believe there's only 2 remaining in the hospital. And knowing that that's the number of people that have tested positive, there are certainly many people in the community that have had COVID and had mild symptoms and never been tested, never needed to be tested, and we'll never know about those. But we believe that for every one person who gets tested because they're sick, there's at least 5, probably more like 10 patients who also have COVID and had such mild symptoms they didn't even notice they were affected.
Can a compromised person be tested to see if they have fought it off somehow? Does that make sense?
Right. So the way testing works is if someone is very symptomatic and you do a test, the chances that it is going to be a correct answer is much higher. When someone's not symptomatic, they could have mild disease and we don't catch it as much in a test. So we don't recommend any test for someone who's not symptomatic, even someone who's immunosuppressed. I will say if someone is immunosuppressed and they are sick with a fever, cough, or shortness of breath, then they are the types of individuals we want to test so that we know what's going on with them and we can direct treatment in that way. Healthy people that have a fever and cough should stay at home, just like they would with the flu. The recommendations now that we've been pushing out because of the CDC's new guidelines, if you have COVID-like symptoms, you probably have COVID, or the flu, that's okay. You do the same thing, which is you need to be at home, you need to be quarantined for 7 days from the time of the onset of the symptoms. And we can put these up on the website later, the link to it. And once you've done that, once you've been at home for 7 days since the time of the symptoms, as long as you don't have a fever for the past 3 days, and as long as you feel well, then your home isolation is done.
I want to remind our viewers that if you have questions for Dr. Dobson, who's the Chief Medical Officer at Southwestern Vermont Medical Center, or Tom D., the CEO of that hospital, to put them in the CAT TV Facebook page as you're watching along. We'll try and answer those. Again, we don't mean this to be a long update from people, but we want to make sure that questions are asked, and we'll provide the answers as best that we have them. Tom, how's the morale of the staff doing? I think what's been the silver lining in a lot of this was just seeing the outpouring of affection and thankfulness for the nursing and doctors, especially out of your award-winning hospital, but the ones that are just kind of self-sacrificing their own health and their own family time as their family stays home to work at the hospital. How are they doing?
Yeah. Well, Matt, our mission is to provide exceptional care to our community, and I think this whole occurrence here is really epitomizing how our employees, our physicians, our board members all really live that mission. It's been remarkable. That being said, I think there's a lot of anxiety. I think, this is a disease that's it's new ground for our workforce and for everyone. And we have a lot of folks who are right in the trenches, and they're nervous, and rightfully so. So we're trying to help to support our employees. We're doing a lot of sessions where we go and we have small discussions just talking about this and helping them. We're helping them with their child care needs, which are significant. We're blessed to have a child care center at SVMC. But all things said, I think it's been remarkable how our workforce has been able to handle the stresses and strains of this, and we need to continue to support them. So I appreciate you asking that question.
Great. Well, our thoughts, our prayers, our thanks go out to those people working right now as we speak across the board, and I think it's nursing and it's doctors and it's the staff at the hospital. It's also the truck drivers that are driving products all around the United States right now. It's the shopping people that are continuing to stock shelves in our local grocers. So we want to give a big thanks to them, as well as the CAT TV staff. I think we need to recognize that of those essential people that are still working, they are essential, including getting communication like this out. So our thanks go to the CAT TV staff for pulling this together. One question around antibodies, that if we have some people that have recovered at this point, is there an ability to, or where are we at in terms of finding a cure, finding an antidote, or at the very least, are there antibodies that are coming out of people that have recovered that can be used to help?
Yeah, no, those are great questions, because that is how disease and viruses work. You develop an antibody which renders the virus unable to attack the cells. Unfortunately, we know that to be true, but coming up with that answer and the ability to have something safe and to administer to patients, as people have read, taken the minimal of 18 months. Now, with this pandemic and the effects that it has had on the world, the chances are we're going to be able to test things a little bit more rapidly and put them into public use more rapidly. But none of us can predict, is that 12 months from now, is that 9 months, or is it more like 18? You probably are aware, and most of the viewers, that there are already at least 2 trials that I know going on right now where people have been given a vaccine to see if they mount an immune response to that vaccine and therefore are protected against the coronavirus causing COVID. But we won't know for at least a couple of months, and then we don't know if it's safe or not. So it takes a little while.
A question coming in about ibuprofen. If I have a fever, trying to deal with pain, is ibuprofen okay to use?
Yeah. So there was some data that came out early saying that potentially it caused some problems. Then that data has sort of since been looked at again and felt not to be significant. I can say that that in general, the idea of using ibuprofen with any of these viruses should not be a problem. So it likely is not a problem here. But there's so many things that are unknown with this virus that if you can avoid ibuprofen at this point and you feel good about it, then you should avoid it. But there's nothing to say that that is an absolute truth, and I know other people who are recommending to take it. So it's really up to the individual.
Okay. Another question here. Do you know whether people build up an immunity after having COVID? And if so, can we identify those people as safe?
Right. I think about this all the time. I think about healthcare workers. I think about myself. Gee, I wish I could just get this and then I could go back to work and life would be good. And in general, actually, a lot of viral illnesses do work that way, but not all. And so when you read the papers that say it looks like people are developing an immunity that is lasting, they mean it's lasting for months, or is it lasting for years, or is it lasting a lifetime? And unfortunately, there is a lot we don't know, as I started this session with. So the last papers I read that came out of China showed that they were, at least for the period of time since they contracted the illness, which was about 30 to 45 days, they seem to have an immune response. But we don't know how lasting that is.
I want to remind our viewers that if you have questions for Dr. Dobson or Tom D, to write them in the Facebook page where we're streaming live at CAT TV, and we will try and answer those questions as we can. Two here, Tom, what's the biggest need right now at the hospital? We had talked a little bit about face masks. What are some other needs that you're seeing or perceive will be in the future?
Well, as you look at our operations, one of the things we're doing, Matt, is we're expanding the number of rooms, and we're putting negative pressure into those rooms for protection of the patients. And so we've gone from, I believe it's probably about 9 negative pressure rooms. We're going to be up to 40 when we're done, over 40. So that's that's a major initiative. It's an operational change, but one which I think it's hats off to our facilities people who are moving night and day to make this happen. So that's a big need for us. We'd love to have more test supplies. I mean, we would like to be doing testing a lot more than we can do. So that's again, as Dr. Dobson said, that's a statewide issue. We're online like the rest of them, but that I would say that's a big need that we have that we're still working on.
Let me follow that up with all SVMC campuses are open throughout the region and even into Massachusetts?
In Vermont, they are all open right now. In Massachusetts, our satellite orthopedic office, I believe, is closed right now.
We've moved staff into the.
So we've centralized orthopedics up into our
Okay.
Dewey Street operation.
Okay. Any foods we're not supposed to eat? Spicy? Obviously a good chicken noodle soup is probably good for everybody right around this time, but
Right.
anything that you're noticing that would make it more susceptible or?
Right. No, and that's the thing with internet these days. You can read whatever you want out there, but there's no association that I'm aware of with any food. I mean, I will say back to one of your original questions, it's remaining healthy in these times when people are at home and they are in a routine that they're not used to. This is a good time to say, what else can I do in my life? What else can I focus on and stick with it?
And when you're self-isolating at home, I know it's hard. It's good to stay home. It's good to stay home and not try to run out to the store all the time to get supplies. I know that's been a concern, but if you can have family members, a friend be designated, one person going out and shopping, those are all things that we should all be doing right now.
Life of COVID on surfaces and in the air. Talk to us, Dr. Dobson, about what we're seeing.
Yes, so unfortunately this is something else that has to be studied significantly. I can tell you that reports out there are anywhere from hours to days. So what most people are saying is at least a couple of days they can remain on surface. Hopefully we'll find out that's not true, that it's less than that. But we believe it's a couple of days. So what does that mean? It doesn't mean you sit around and wait for a couple of days. It means that you use the disinfectants to wipe the surfaces that people frequently touch. And that's what you focus on. You can't wipe your whole house down. People get very anxious and they're wiping places that you never touched, and you need to focus on the areas that you're going to be retouching over and over again.
Tom, how is the Bennington Rescue Squad and general EMS services? Are they helping, and how are they helping?
Yeah, well, we're in contact with them a lot. Actually, I just met last week with Art, and they are, they're a key ally as we look to develop our surge plan. Especially if we end up expanding our surge and go off-site to a location, they'll be integral in terms of our initiatives. I know they're working hard too on getting PPE equipment there, and so that's a concern that Art has expressed to me, but. They're part of our medical team. I mean, Dr. Dobson, who's lived most of his career in the emergency room, will know that they're in there all the time, and they are directly related to what we're doing here. So as we develop our plans, they're an organization that we stay very close to, and we coordinate together and we plan together.
Great. Final question here.
And by the way, they are one of the best ambulance services in the state of Vermont. We're very fortunate to have them here.
Absolutely.
Incredible staff.
There was a great article that we pushed out with the help of SVMC recently. I encourage everybody to go to swvtchamber.com. Right on the front page is really world-class healthcare in the shires of Vermont, right here in our region, and I think it takes it all the way from cradle to the passing of life, and that article is just so so good at showing all the integral pieces to our healthcare society that we have, whether that be the nursing homes, which are stepping up amazingly during this time, to obviously your facilities, to the dentist office, to everything, the pediatrics.
And another shout out to the home care agency
Yes.
of Southwestern Vermont. We have one of the top home care companies in the state, and they're, I think they're a 5-star rated for Medicare. So we have a lot of providers that are at the top of their game.
Absolutely. Couple final questions. What has been the turnaround time on tests that have been administered?
So initially they were within 24 hours and they got delayed, as you would imagine, but they're now down within 72 hours. Originally they were all going to the state lab. Now UVM has taken over a significant portion, and they're starting to use commercial labs. So I'm going to say 72 hours, not to disappoint people, but it will be within 48 pretty soon. And I can tell you, within 60 days, which seems like a long time away, but we'll probably be at the point where we're able to do those tests in-house and have them back within, a matter of a half day to a full day.
Let's wrap up here. Specifically, Dr. Dobson, in your definition, what does social isolation mean, and how best can everybody watching practice that today?
Sure. Well, first off, it doesn't mean going into a big despair and depression state because you're not interacting. You have to interact with your family and with your friends from afar. So some examples would be, certainly everyone knows that they can't be in large gatherings, but really they can't be going out at all with friends. They need to stay indoors with their family and then go outdoors with their family, giving that distance between people that's appropriate. I'll tell you, Matt, I was up at Bromley skiing the other day, and I could not believe there was over 100 people out there. But they all stayed their distance. We stayed very far away from each other. We enjoyed the sun, and that was healthy.
Can you get in a car and go travel around? I mean, my understanding, again, to your point of social distancing, it doesn't mean housebound, encouraging people to be cautious to go out for walks and things like that, but really, hop in the car and go explore some of the great places we have in Vermont as well.
Yeah, you certainly can. You just have to be careful in where what your plans are for the day. You're not going to stop and go into a restaurant, but getting your car and going other places is totally fine.
This may not be a specific question that you gentlemen can answer, although I'll put it out there as we wrap up. Is the health inspector doing random checks around town? I think there's been some, as we do takeout week this week, people have some concerns, I think, about the food, and obviously the people touching the food. So I guess from your background, is food safe? And let's also put onto that, what about the health inspector? I'll even add in there the mail system, as the post office is still delivering mail. What does that mean, and what should we do?
So first off, not a health inspector, so don't know exactly their activity. I can say it is not a known way to spread influenza, coronavirus, and other viruses through the handling and touching of food. You should use the hand sanitizer as much as possible. I believe all of those folks they're using it for their own safety as well as the safety of those people they're serving food to. I would not be worried about that, nor from the mail. And that's been pretty shown. You still do need to be diligent with the hand sanitizer. So if you're touching anything around the house, use the hand sanitizer regularly.
In final moments here, Tom D., any final thoughts? As we've promised our audience, we will come back as much as necessary to communicate with the general public, but final thoughts from Tom D. or Chief Medical Officer Dr. Dobson.
Well, Matt, I would say to your viewers, don't panic. We'll get through this. We're working together. I think we have a great team of healthcare experts as Trey is, and our goal is to try to communicate. And if you have questions, call us, look at our website, very important. And we have great information out there, and this may take some time, but we will get through it. And it's almost like the whole question on your investments. Don't panic and act, and don't do anything rash.
Yeah, I can say, Matt, that from from the nurses and physicians in the front line, what we've been telling each other is we can't be paralyzed by anxiety and fear and being led into some state where we're ineffective. But we also can't be lulled into complacency. This is very real, and we have to address it, and it's going to be a marathon. It's not a sprint.
Great analogy there. I want to thank all our viewers who tuned in today. I want to thank the CAT TV studio and the staff here at CAT TV, as well as the chamber staff that have been working with me to pull together all the information many of you have received, including this telecast. This telecast was broadcast live from CAT TV studios in downtown Bennington. We will also have copies of that both on the CAT TV website as well as swvtchamber.com. We will have recordings of this telecast. Don't forget to tune in on Thursday at 1 p.m. as Lorna from UCS, as well as some other people, other friends from UCS, join us to talk about mental health during this time. Again, thank you everybody. Be safe and have a great day.